Okay, welcome to today's presentations. My name is Donna Messersmith, and I'm representing the National Human Genome Research Institute. I'm one of the co-chairs of the Inter-Society Coordinating Committee for Practitioner Education in Genomics, or ISCC-PEG. And for today's presentations, we're proud to have a graduation or wrap-up presentation of our first class of the 2022 ISCC-PEG Scholars Program. And so I want to welcome everyone here and tell a little bit about the program. This is a program that was started in 2020 with the goal of connecting students, who we call our scholars, who are at varying levels of their training, with members of ISCC-PEG. And our members run a broad spectrum of healthcare providers and genomics educators, all with a keen interest in genomics education. And that is the goal of ISCC-PEG. So this was an opportunity to match people who are more experienced in their careers with people who are just beginning. And the program, from our perspective, has gone great. And today is the final presentation for our first class, the 2022 scholars. And we will be giving all of the participants a certificate, which I don't know if you all can see it on my screen, but anyway, we'll be giving out certificates to everybody who participated, and they will be coming to you a little bit later. We're getting the signatures together, and just as a token of our appreciation for your participation in this program. Couple of quick announcements. We continue the program this year, and we have extended our deadline to November 1st. So if there's anybody on the call who's interested in applying for next year, it's a 2-year program, and the applications are available on genome.gov/ISCC. And that URL is on the agenda there. And thank you again to our participants. We will be looking for your feedback and sending you all a survey within the next 2 weeks or so, so that we can learn how the program went for you and ways we can improve and what we can do next year. So with that, those are my introductory remarks. And all of the mentors, I believe, are on today's call. So they will be providing introductions to each of their scholars. You can learn from the agenda more information about not only the scholars themselves, but their mentors. And that was a very important relationship. That was a critical relationship to the whole program. And we want to thank the mentors. Mentors will get certificates as well, because their role was key in making this program a success, as well, of course, as the scholars. So with that, I believe Michelle Snyder is our first mentor to introduce Kelsey. And if you turn your video on, Michelle, then you can make the introduction.
Yes, hi everyone. I'm very pleased to introduce Kelsey Ellis, who I so enjoyed working with over the past 2 years. Kelsey just recently graduated with her master's in genetic counseling and also passed her board exam, and now is a cancer genetic counselor at the Huntsman Cancer Institute in Salt Lake City. So I really appreciated all of Kelsey's input and her ideas for this project. She did a great job, and I think she's really produced a really great prototype for an app that can be really useful for genomics education. So I'll let her give her presentation.
Thank you so much, Michelle. Appreciate that introduction, and let me go ahead and share my screen. Okay. All right, are you all seeing the regular view and not the presenter view?
Yeah, it
Perfect.
looks
All right, great. Well, I'll go ahead and get started. Thank you all for being here. And yeah, thank you so much for this opportunity to participate in the ISCC-PEG Scholar Program. It's really been a great experience for me. And I could not have created this app that I'll be talking about without Michelle's help in particular, and the help of many, many other ISCC-PEG members. Without further ado, I'll go ahead and get started. So I'll be talking about this app prototype we developed called Gene Test 101. And it's an app for healthcare providers working with rare disease patients. So the overall goal of my project as an ISCC-PEG scholar was to create a tool that could be utilized by healthcare providers as a point of care resource throughout the genetic testing process. The audience we had in mind for this project were, generally speaking, healthcare providers who interfaced with and kind of interacted with the process of genetic testing, but who didn't specialize in genetics. So people like pediatricians, family physicians, PAs, NPs, and other similar providers. The app prototype, or what we're calling our beta version of the app, is now complete. It's live. Please use it, please share it, and it's accessible from this tiny URL link here. I'll be showing this again at the end of the presentation, and I'll also put it in the chat afterwards. So just an overview of my overall project and time as an ISCC-PEG scholar over the last 2 years. Kind of stage one of my project was developing a resource toolkit and one-pager to accompany the Rare Disease Project Group's workshop at the, I guess it would have been the 2021 PAS workshop. Then I took that kind of toolkit I developed and created an app prototype using those materials and information. We then conducted an evaluation of the app, made some revisions to it, and are now in the stage of the app being live and disseminating it and sharing it. So this is just a kind of screenshot of the one-pager I developed for that PAS workshop, kind of helping to walk providers through the process of genetic testing, pre and post-test counseling, and trying to include some really key and helpful resources that people can use. I also created an Excel-based resource list to kind of hopefully synergize with that one-pager and just kind of give a little more detail about some of those resources. In terms of the app development, the app was created using a Google Slides template and optimized for use on mobile devices. So if you go to the app link that I shared on your smartphone, you'll see, hopefully it looks and acts pretty much like you would expect an app to on your phone. It's also completely usable from a computer screen. It just kind of still has that vertical rectangular format. And like I mentioned, we adapted content from that PAS workshop toolkit to address the genetic testing process, included instructions for users to add the app to their phone's home screen, converted the toolkit Excel database into a section called the resource list, and added links to download those resource or that PAS workshop toolkit materials if people were interested in doing so. So this is just a really brief example of what it looks like utilizing the app. So say you're interested in explaining some genetic test results to a patient, they have negative results, click on that, get a little more information about that process with a few more links. Say you're interested in, okay, do I need to talk about follow-up testing? How do I do that? And kind of where do I go if I feel like at this point, I'm kind of going beyond the scope of what I'm prepared to do. You can kind of access some further resources and information from there. Similarly, in terms of that resource list I mentioned, from the homepage, there's this list of resources connected to those different aspects of the genetic testing process. And if you click on a section, you go to that list of resources related to that section. After we created the initial version of the app, we did get a lot of informal feedback as we went along from ISCC-PEG members and other groups, but we also wanted to try to do a little more of a formal evaluation, and so created a Google Forms style survey that we disseminated to a number of different groups, and we didn't get a ton of responses, but as you can see here from this top pie, we did get responses from a range of providers, which I thought was really great. We also got responses from people who interacted with genetic testing weekly to monthly, which was about kind of the audience we were looking for, people who aren't utilizing genetic testing every day, but who do have some familiarity with that process. We got feedback from people using both iOS and Android, which was great, and people kind of with a middle of the road range or level of genetics knowledge, which again fit with the audience we're hoping will use this app. We were particularly interested in whether people needed additional instructions to utilize the app and whether they were able to add the app to their phone's home screen. We really want the app to be easily accessible to people, and I think having it be kind of as an app on the phone is a big part of that. So you can just click on it and utilize it without having to look up a URL or anything like that. And we did find that majority of people were able to utilize it and add the app without issues, but that was, I think, a point of friction for some of our respondents, which we worked to address. And lastly, just wanted to show some of the Likert scale responses we got from our evaluation. Basically, one indicates a more negative response or a feeling of less confidence using the app, the feeling they would use the app less frequently, it's not easy to use, and 5 means they strongly agree that they are confident using the app, it's easy to use, etc. And kind of as you can see here, just kind of briefly touching on this, overall responses were pretty positive to the app, which we were excited about. Of course, always room for improvement, but didn't see any huge issues in terms of how people felt about the app after exploring it for a little bit. We also got some open-ended questions that we had people answer and worked to address some of those issues related to acronyms and terminology, that home button aspect that I mentioned earlier, and some other issues listed here. We also got feedback that the app was easy to follow, had good resources, and a large number of them, and was well organized. To make revisions to the app, we created a PDF that provided an overview of how to add the app to the home screen using kind of actual photos and visualizations of how that looks on both iPhone and Android, because we thought that would maybe be a helpful way for people to work through that process, as well as just providing a little more information about the app in general, as you can see at the top there. And there's a link to that PDF. It's also accessible from the Add to My Home Screen button on the app. We also made a number of other style and wording changes to increase consistency and accessibility. And now coming to where we are presently, we are planning on submitting the app to NHGRI's Genome Ed Resource Repository. We're hoping that ISCC-PEG membership will help us to share and disseminate this app, and are definitely open to any thoughts or suggestions or opportunities for other ways we can help to share and disseminate this as widely as possible. And with that, I want to turn it over in case anyone has any questions. This QR code here, you should be able to scan using your phone to access the app, and those links to the app instructions, the app itself, are listed on the left, as well as an email address if anyone wants to contact us now or at a later date about the app. And without further ado, a huge thank you again to everyone who's helped me with this project. It's been a great experience, and I'll turn it back over.
Thank you so much, Kelsey. Yeah, this was great to see the evolution of this project, and thank you for the talk today. So my colleague Roseanne Wise is helping out with the chat. So if you have questions, we have actually a huge turnout today, which I'm very pleased about. So I think to manage the questions, that we could get. Let's use the chat to put your questions in the chat, and Roseanne has kindly agreed to help monitor the chat since we do have quite a number of people participating.
Hi there, this is Roseanne. So I see we have a question. Fabulous, thank you, Kelsey. Is the plan for this app to eventually be available in the App Store or just on genome.gov?
That is a great question. So, Michelle and I have talked a little bit again, like I mentioned, we're thinking of this as sort of like a prototype or a beta version of the app. We, created this without any extra funding or anything like that. So we would love to explore ways to make it more accessible. I don't think we've really looked into how you add the app on the App Store, and I don't know if that does involve any funding or if the app would need to be in a more kind of finalized format, because you'll notice if you access it, it is actually a set of Google Slides that are just formatted in a certain way and shared in a certain way that you can utilize it like an app. So I don't know that we would be able to, at this point, add it to like the App Store, but something like that would be really wonderful at some point in the future. And we're definitely open to and kind of thinking forward about ways to maybe take this to the next level if possible.
Thank you. Dr. Brody, do you want to unmute and ask your question?
Sure. I thought we're a small enough group. If you're okay with having people just unmute or raise their hand, I don't want to take too much time, but it was very, very cool, Kelsey. I just had a question about how you foresee the doc using this. So is it Dr. Google where they leave the patient in the room, they go out and they look at their phone and come back? Or would it be more likely to be shared with a patient? And if it is in the App Store or on our website, you also have to assume that patients would come with it to their appointment potentially and not having the doc see it at first. All those settings, if you think through the uses of it, will work in all those settings?
Yeah, that's a great question. I think the way it is designed is not necessarily something that you would need to use like in the moment. It'd more be like, okay, like someone's coming in, I'm going to think through, if I need to order genetic testing, like how am I going to do that? Or I've gotten results back, what are these results telling me, or what resources should I share with the patient? So I think the most likely situation, at least I think kind of the way we designed it and the kind of with the information we included, might be utilized outside of that moment or that period where the physician is interacting or the provider is interacting with the patient. But it is very true. Like say a patient comes in and they bring in genetic test results and you're like, oh, like wasn't expecting this. I think it would be more like that sort of Dr. Google situation that you mentioned where the physician might want to or need to step out of the room. And to address your kind of last component of your question, it would be something that would be accessible to anybody if it is on that Genome Ed repository. I think the language would be in the kind of level of information would likely be a little difficult for most patients to utilize or like kind of fully understand. But that's a great question. I don't think we really thought through or thought a lot about like patients utilizing the app, but that's really good food for thought.
And I know there's a lot of interest in this project. If you have additional questions, we can move them from the chat to the scholar, but we have 2 more presentations. So I think
I'm just going to say something though quickly.
Sure.
So thanks. I just think, Kelsey, it's a great project. I just want to suggest, I saw you're at University of Utah now. That's where Sabrina is, right? So, I mean, you could implement something there to get really more data that would help answer some of Dr. Brody's questions, which I think are good ones, right? So I know you're just starting, but really the fact that you're there where the leader of that project group is, seems like you have contacts with people who might actually use it and do a larger study. So I just wanted to say that because, you know, if you want to keep moving with it, I think there are definitely opportunities.
Great, thank you, Rich. Yeah, that's definitely a great thought, and yeah, I agree. Small world that ended up at the same institution as Sabrina and them. So anyway, thank you all so much. Yeah, like Donna said, I'll turn it back over to the next scholar presentation. But please, if anyone else has any feedback, please reach out. Happy to continue these conversations.
Great, thank you. Okay, let's take a look at the agenda again. But we know who's next. So Christine Cruz, are you there and ready to introduce Katherine Robinson?
Yes, I am.
Great.
Hi, everybody. Kelsey, that was excellent. Thank you so much. So I'm Christine Cruz, and I practice at St. Jude Children's Research Hospital, and it's my pleasure to mentor Dr. Katherine Robinson, who's a scholar in the pharmacogenomics subspecialty. So Katherine brings a wealth of experience to this project, which you'll see in just a minute. I can't wait for you to see what she's created. Katherine is a board-certified pharmacotherapy specialist and a residency-trained clinical pharmacogenomics specialist. And she's currently a fellow at the University of Pittsburgh School of Pharmacy. Katherine has been working on a case-based educational project for oncology practitioners, and she's going to share that with us now. So please go ahead, Katherine.
All right, thank you so much, Chris, for the introduction. And it's my pleasure to be here today to present on my final update for the Scholar Project. Can y'all see the beginning part here, or is that hidden? I don't know why that's still.
You can see
okay.
it. I think it's good.
You can see it. Okay, great. Several regulatory agents acknowledge the impact of germline pharmacogenomics on the safety and efficacy of various chemotherapy agents. The Food and Drug Administration includes in its package insert pharmacogenomic information for irinotecan, fluoropyrimidines, and 6-mercaptopurine. The European Medicines Agency, or the EMA, takes us a step further and actually requires pharmacogenomic testing or another phenotypic test for DPD deficiency prior to starting fluoropyrimidine chemotherapy. And the European Society of Medical Oncology incorporates this pharmacogenomic information into the guidelines for colon cancer. In addition to regulatory agencies, there are several practice guidelines that provide specific dosing recommendation based on pharmacogenomic results for both chemotherapy agents and a variety of supportive care medicines that, as you can see listed on the slide. These guidelines are written by the Clinical Pharmacogenetics Implementation Consortium, or CPIC, and in the case of UGT1A1, specifically the Dutch Pharmacogenetics Working Group. However, despite the information being in both package labeling and these practice guidelines, providers often do not know how to alter prescribing based on pharmacogenomic results. In a community health system, 75% of physicians do not feel confident in modifying medications based on pharmacogenomic results. And then if we look specifically at oncology, only 7% of pediatric oncology providers felt that their training had adequately prepared them to use pharmacogenomic results clinically. And 30% of adult GI oncologists reported being uncomfortable or very uncomfortable in applying these results to dosing chemotherapy. And so pharmacogenomic education is needed for effective implementation. We can see in a variety of different surveys and different settings, the majority of clinicians do see the value of pharmacogenomics, but they're uncomfortable with incorporating it into practice. And furthermore, pharmacogenetic results are increasingly available in electronic medical record. And so even if a provider doesn't personally order this test, they are still faced with having to know what to do with this information. And many studies report on the importance of clinical decision support to provide point of prescribing education. However, it's only available currently at certain institutions, and other providers may wish to incorporate pharmacogenomic testing into their practice, or if they aren't familiar with the information before seeing a clinical decision support alert, they may ignore it or still not know what to do. So that's where my module comes into place because the widespread implementation of pharmacogenomics is limited and lack of education is a documented barrier to this implementation. So we've designed online interactive modules that are case-based, which are directed towards oncology clinicians who are responsible for ordering and modifying and monitoring these medications. So when designing my module, I use the ADDIE instructional design model, which is an iterative process that has the following steps: analysis, design, development, implementation, and evaluation. For the analysis phase, I conducted a needs assessment where I considered the background of the learner, so those specifically oncology practitioners, the needs of the learner, focusing on problem-based learning to achieve skills at the end of the module, and considered which platform would meet these goals. So I really wanted an interactive platform where the learner could directly engage with the material and the ability to incorporate quizzes, both for immediate feedback for the learner, as well as the ability to award CE at the end of it. And we wanted to leverage the path that the ISCC-PEG Pharmacogenomic subgroup has already forged for publishing these modules. So currently, the ISCC-PEG Pharmacogenomic subgroup is going to host their modules that they've already created on the University of Pittsburgh webpage, so that CE can be awarded. And so we feel like this is a good place for my modules as well. In the design phase, I set learning objectives after reviewing competency statements, genetics. I also determined which educational frameworks I would incorporate into the module and what design elements would be needed to achieve that interactivity. Here are my learning objectives. And so you can see how I utilized Bloom's taxonomy hierarchy, where we start with knowledge and comprehension, followed by synthesis and application in the determining appropriate dosing. For the educational frameworks, I relied on problem-based learning, really focusing on the skills that providers would need to use this clinically, instead of really delving into all of the background and theories and history of pharmacogenomics. I also utilized scaffolding, where I broke down these complex skills into building blocks so that I would walk the learner through these more basic steps so they could build those skills over time. I incorporated a variety of formative assessments so the learner could get immediate feedback in low-stake settings to make sure they were achieving those skills. And then finally finished with a summative assessment where they have to synthesize those skills and information for the final assessment for CE credit. Then I moved into the development phase, where I put my module planning into production. I'm using the RISE platform. So I will show what that looks like. So this is online, but can also be formatted to like a mobile device or a tablet as well. I'll walk you briefly through the module for DPYD. So we start with a pre-knowledge check so that the learner knows kind of where each section is going. I've incorporated a variety of different media, including simple text. I also incorporate some interactive images. So if the learner wants to learn more about a specific area, they can. Some images, and also I've been able to incorporate different videos for more complex topics, such as mechanisms of action, and then why the pharmacogenomic information is important. And then we return back to that same question with feedback to make sure the learner understands. Next, we have examples of scaffolding where we really break down like the skill of interpreting a genotype into its basic parts. I break down what each part of that nomenclature means. And then we build from that an activity score. And I think it's really important to direct learners to resources that they have available in the real world. So the Clinical Pharmacogenetics Implementation Consortium website, and I walk them through exactly where they need to go on that website to find the information they need. And here's an example of some interactivity with matching to assign a phenotype. And then finally, they use that information in the same case to actually dose the chemotherapy agent. So our next steps are the implementation and evaluation phase of the ADDIE module. So we'll finalize production in RISE. We'll have expert review, a pilot evaluation with the intended learner, and with dissemination online for CE credit. And we'll also apply to be hosted on the Genome Ed website. And we've also discussed applying to speak at different online society meetings. Oncology society meetings. So I'd like to thank my mentor, Dr. Christine Cruz, for all of her help in the design and execution of this project and all of her encouragement throughout the journey. And then Dr. Phil Empey for lending his expertise and education to this project, and to Dr. Ashley Stewart, the instructional designer in our lab, for her help with the platforms and the educational framework. And finally, I'd like to thank ISCC-PEG for supporting this program, especially Donna and Rich, and the pharmacogenomic subgroup, and especially Dr. Andrew Monty for their support as well.
Well, thank you very much, Katherine. That was a wonderful presentation. And we do have just a couple minutes for questions. Again, if we can't get to everyone's questions, I think Katherine would be happy to connect.
Absolutely.
So Roseanne, do we have? Yeah, sorry, I can't see hands, but Rich.
Dr. Haspel's hand is up, yes.
Okay.
Did someone else have a question first, or?
Not from what I can
I don't see anything in chat, so.
Yeah, there's
again,
nothing.
a great project. Just, do you have, I'm guessing there would be a link for this. I just want to keep in mind, we now have the Genome Ed stuff. So hopefully, there'll be a review process for that, but, because really to think about disseminating and how you can do that. I also just want to say, I see that RISE uses articulate storyline. Is that the tool? So there's some neat things.
Yeah.
You might know this already, but articulate, you can do things like simulations and stuff. And we've done things like going to websites. Like you can have people, you can simulate like using PharmGKB or something like that. So articulate has some real neat interactive tools if you're not, but you probably have to find someone who's, but anyway, great idea. Thanks.
Thank you. Yeah, we'll look into that for sure.
So anything else in the chat, Roseanne?
No, there is nothing in the chat.
All right, well, thank you again, Katherine, and our time is tight, so I think we will move on to our next talk. And Phil Empey, are you available to give an introduction to our next
I am.
Scholar? Great, thank you,
Yes.
Phil.
Hi, everyone. I'm Philip Empey, the University of Pittsburgh, and it's my pleasure to introduce Samantha Bailey. Dr. Bailey is a pharmacist, Doctor of Pharmacy degree, awardee from Pitt Pharmacy in 2020, and we were really fortunate that she stayed on and is seeking her PhD here in clinical pharmaceutical sciences here at Pitt, where she's focusing on pharmacogenomics implementation in mental health. She has a real passion for education, has been involved pretty heavily in innovative approaches to educate. And today she'll share her research about the landscape of genomics education, especially pharmacogenomics education offerings within ISCC-PEG.
Right, thank you for that introduction. As Dr. Empey said, I'll be sharing a landscape analysis of pharmacogenomic education within ISCC-PEG partner organizations. Right, so as we're most likely familiar with, genomic medicine is a rapidly growing field incorporating the environment, lifestyle, and genes of an individual into a personalized treatment plan. Although genomic medicine has the benefit of improved outcomes for patients, there is an increased demand on providers to provide that individualized care. And that means there is an increased need for readily available education to train these providers. However, studies have shown that there is practitioner hesitancy in utilizing genomic medicine. Studies have shown that providers have felt unprepared to use genomic medicine, and that's due to a lack of provider familiarity. And an ISCC-PEG survey conducted, I believe, in 2018 showed that there was an uneven adoption of genomics across healthcare professions and even within the same healthcare professions, such as physicians. There are multiple barriers to implementation of pharmacogenomic medicine specifically, and this includes limited time of practitioners, the sheer quantity of information, and whether practitioners know where that information is located. While there are prior studies that have looked at what education is available, it's always from the learner's perspective. If it is from an organization, it is done as a web-based search, and there's minimal feedback from different organizations. So conducting a landscape analysis was really a new approach to look at the organizations directly and determine if there were gaps in pharmacogenomic education across ISCC-PEG partner organizations. So for my study, I had 3 specific aims. The first was to determine what the currently available pharmacogenomic education was within organizations, then to determine the perceived barriers to pharmacogenomic education implementation, and the third was to determine the opinions on what helpful pharmacogenomic education materials look like. So for this, I developed a survey, and it was approved by both ISCC-PEG and our local IRB. Through Qualtrics, it was mailed out to the ISCC-PEG mailing list. It was open for about 6 weeks and had about a 26% response rate. Individuals could answer as on behalf of an organization or as themselves, and the survey covered 3 domains: currently available education, barriers to implementation, and perceived helpfulness of educational materials. So to briefly go over the demographics, there were 70 unique responses. 28 came from individuals and 46 came from individuals representing specific organizations. Out of this, there were only 37 unique organizations, and if there were multiple responses for an organization, their responses were averaged. For my analysis that I'll talk about today, I focused on organizations just due to the complexity of how individuals answered the questions. So I broke these 37 unique organizations down into 5 different groups. First was professional societies, or really organizations that represented a portion or all of a profession, medical centers, educators, industries, and research groups, which really just encompassed different kinds of labs. So here we can see the percent of organizations which represent a specific profession. We can see here that mostly physicians, researchers, educators, and students were represented by this sample. That's something to keep in mind as we create new educational materials in pharmacogenomics, but these are the type of learners that we'll be seeing most often. Moving on to what education was available, when asked about any type of education, we found that 95% of organizations had some type. To orient you to the graph on the right, from the bottom to the top, we have almost no resources available in an organization to an almost complete set of resources for an organization. And then across the bottom, we have the 5 different groupings that I placed into. We did find that 58% felt that they had an almost complete set of resources or only needed minor additions. Each organization on the right-hand side as well is represented by 1 dot, so that's how we can see the different groupings. When looking at genomic-specific education, we found that there were just fewer organizations with that type. Found that 89% of those that had any education had genomic education, And we saw that 54% felt they needed major additions to their curriculum, or they had almost no resources at all. When finally funneling this down into pharmacogenomics education, we saw that 68% of the total 37 unique organizations had some type of pharmacogenomic education. We can see on the right-hand side that there is a bigger spread of who felt they had more resources or not. We could see that most organizations need at least minor additions, but most also felt that they needed either major additions or felt that they had almost no resources. I wanted to further look at the different types of education. So I looked at specific domains. Here I broke it down. So this will be the percentage of organizations within a specific group that had a specific type of pharmacogenomic education. So something to look at here, and something that was interesting, is that educators, medical centers, professional societies, and research groups all were represented well throughout the different domains. Those in industry, however, looked like they focused more on the overview of PGX, as well as patient-provider communication and cost and coverage. So this is something to keep in mind as we create new materials, that perhaps we can focus more on these specific domains and implement those types of pharmacogenomic education. Next, I looked at the barriers to incorporation of pharmacogenomics education. I broke it down into education-based barriers and implementation-based barriers. To orient you to the heat map over here, the darker the color, the more intense, or the the higher percentage of individual organizations felt that that was a barrier. And at 60%, it just switches over to red for ease of viewing. So looking at education-based, we can see that all organizations felt that maintaining an up-to-date pharmacogenomic curriculum was at least a significant or somewhat of a barrier. But we can also see things such as unknown pharmacogenomic resources or a lack of resources being available within the organization were also important barriers. Looking at implementation-based, we can see that a lack of member expertise in pharmacogenomics was a big barrier for groups. However, we can really see that all of the listed barriers are at least somewhat of a barrier for most organizations. Next, I asked what helpful pharmacogenomic educational materials may look like. And we can see that all organizations believe that all of the types of educational materials are at least somewhat helpful. Again, the darker colors represent higher percentages, and we can see that webinars and hybrid courses were highly favored as helpful resources. Things that ISCC-PEG are already doing, such as self-study modules, are also heavily favored. So that's promising, as we're already creating these types of materials. So really at that point, it's just how we disseminate those materials as being important. So overall, we found that most organizations have pharmacogenomic education, but require major additions. We also saw some of the same barriers that we saw for individual professions, as having access to available education being a big barrier, as well as maintaining an up-to-date curriculum. Many organizations view materials that ISCC-PEG is already creating as valuable, like I said, the self-study materials. However, creation of educational materials with live sessions, such as the webinars, may be important for future education development. Also, with live sessions, it may help to increase member involvement, as they feel they can actually speak with someone who understands the curriculum better. In the future, I do want to conduct another analysis that does look at the between profession differences. That would increase my sample size as well to see if there are any significant differences between professions, and it would help to include those individual responses. I do plan on conducting interviews with individuals who completed the survey and said that they were interested. I think that would help to further clarify what types of educational materials are important, and if there's any clarification within the barriers to specific organizations. Also, as the pharmacogenomic group continues to develop materials, they may start to include domains where specific education is needed, and they may be able to even partner with specific organizations to either bolster their materials or continue to bring that to a wider ISCC-PEG group. that, I'd like to thank all of the individuals who participated in the survey, as well as my mentor, Dr. Empey, the Pharmacogenomics Project Group as a whole, and Andrew Monti, ISCC-PEG, specifically Donna and Rich, and thank you for giving me the opportunity to be a scholar, and then all ISCC-PEG members for all of the feedback that I've gotten. With that, I'll have any questions.
Thank you so much, Samantha.
Yeah.
I see a few indications of comments in the chat.
Yes, Kelsey updated the email address she had put in earlier for the Gene Test 101 app.
So I have a question. If so, again, these are all great, and I'll do a little summary in a minute. But remind me, I'm sorry if I missed. Was there a question just sort of like, because I know how the ranking was like, don't need, like, have a lot of resources, major additions, minor additions, and then almost none. Did you get a sense, like, the people at almost none, do they want them, or are they just, does that make sense? Like, people might not have it, but they don't necessarily want it. Was there a question related, sort of get that sense?
So there wasn't a direct question that asked, do you want education? There were questions that asked if they would like to partner with ISCC-PEG. While some organizations said no, they didn't specifically want to partner with ISCC-PEG in pharmacogenomics specific. I would say most of the answers seemed enthusiastic about at least having some type of pharmacogenomic education. And I think some of these results, although directed towards pharmacogenomics, may also be applicable to the other project groups or other areas of expertise.
Yeah, no, I think you know, 70 and 13 organizations is pretty good. So can definitely be a model for some other needs assessment type things. So, all right, Donna, should I bring it home or?
Yeah. Thanks, Rich.
Not that I have that much more to add, but anyway, it's really very rewarding to, like, you know, we came up with this idea at like one of our annual meetings, and thanks to Donna and others at NHGRI, able to put this together. And you guys are a first class, and you've really done some great stuff. I would just encourage, really, keep doing, you know, I think most of your projects at least could be an abstract in a national meeting, and maybe, you know, papers or so. Keep, if you, again, you know, it depends where your career takes you, but, you know, consider, you know, how to keep moving forward. And I'll just share something, and sorry, Donna, I'm assuming you'll agree with this, but it's something one of my attendings, one of the physicians I work with once said, who taught me. He said, you have a lifetime warranty. So if you ever want to contact me about anything or whatever, even after you leave the, you know, where I'm training, you know, it's lifetime warranty. You can always reach out. And I try to share that with the trainees I work with, and they'll sometimes contact me with questions, but any way we can continue to help, as, you know, please reach out. And you've all received you are all now, correct me if I'm wrong, Donna, members, official members now of ISCC-PEG. So please, we hope you'll continue to contribute, and even, you know, whatever allows for things. So this has just been terrific. And thanks to all the mentors too. I know there's a lot of work there as well. I mean, the stuff you guys put together, and it's our first iteration, it's just tremendous. So thanks again for being so enthusiastic, because, you know, the really thing here is we provided support. There was no money, there was nothing, but, you know, it's great that how enthusiastic everyone was. And any way we can help in the future, let us know.
Yeah,
So,
and I want to add to that, Rich. I completely agree with everything. Members of ISCC, certainly. And in the near future, I want to make sure that, you know, we communicate and put the links as they are available on the ISCC-PEG website. That's, you know, that's a given. We'll be happy to do at least that. And as several of you mentioned, Genome Ed is a great place to input, your resource. But beyond that, you know, we look forward to seeing publications, and we can put links to publications. Let's keep the dissemination effort going. And like Rich said, this has just like been very satisfying to see the excellent progress that you all have made. And you know, can't thank the mentors enough. This was just great for people to step out and support you all. Thank you.
I'll just add one other thing. Thanks to all of you who came on the call who weren't a mentor or a mentee to show support and for the program, because, you know, it looks like we have 39 people on, which is great. And that's definitely more than the mentors and mentees. So we're glad that, thank you for doing that. And please, to all the mentors and mentees, Donna, we'll send out some feedback material so we can get some feedback, because, you know,
Right.
we're still working on this, and anything we can do to, you know, improve, or also things you liked that we can grow with. So.
And also to follow up on Rich's comment about, we had a great turnout of participants in today's call. And please do consider yourself as a potential mentor, because we have a new class coming in.
Yeah. And yeah, and a real diverse nature of projects. It's just been, so anyway, we won't keep you any longer, but we'll send you your certificates, well deserved. And again, thank you all. It was really great to listen to all your projects. So
We had one question in the chat. Will these slides be made available?
Yes, all three of the scholars agreed to have their slides posted, and we'll be working on that, as well as a recording on the ISCC website.
yeah. All right, Don, anything else?
No, I'm good. I'm
right.
just thrilled.
All right, so thank you all for joining us. And we hope to see all of you at our next ISCC-PEG call, which is first Wednesday in, it's in November, right? We have one.
Right. So that's November 2nd. Let me just make sure. Yes, November 2nd.
Okay. All right, everyone, have a great day. Thanks a lot.
Thank you.